Okay, Assalamu alaikum wa rahmatullahi wa barakatuhu. Bismillah ar-Rahman ar-Rahim. So it's good to be with everyone this evening. I'm going to inshallah be discussing how to achieve a hormone balance in men and women. I'm going to talk a little bit about women first and then men, and then we'll do a Q&A a little bit at the end. So my name is Dr. Omar Akhter, and a little background about me. As an introduction, I'm an internal medicine physician, and I did my residency training in New York City. And I moved to Austin about 4 years ago now, and I continued my hospital-based practice, but also started a private practice, which is now here in Cedar Park, where I'm treating patients more holistically, meaning I'm incorporating aspects of diet, lifestyle, and using various supplements, things like that, to try to have a better approach to these patients that need chronic disease care. So the first thing I want to mention is the current model of care that we have in our medical system. And I use a term, I called it the P&P model of care. And what this means is that when we have various symptoms, we go to our physician or our practitioner, and usually we get one prescription or we get multiple prescriptions. And if those prescriptions can't help the situation, then we're recommended a procedure. So these are the offerings that we get in the conventional system. A lot of people are used to this. A lot of people are frustrated with this. And this is why we're not able to achieve improvement in our symptoms of chronic disease. And this is why people are not getting really well. So the chronic disease needs a much more nuanced approach, and that's why I'm trying to get away from this P&P model of care that I've called, and that's why it's very important to incorporate more of a holistic model. So we're going to start by talking about hormone balance in women. And obviously there are a lot of hormones involved when you say hormone balance. There's estrogen, also pronounced estrogen. There's progesterone, there's testosterone. There's a hormone called DHEA. There is cortisol, insulin, thyroid. So these are all the hormones involved and many more. But for the purposes of our limited discussion, we're talking about specifically the female hormones like estrogen, progesterone. And it's important to realize that all of our hormones come from cholesterol. So cholesterol is the building block of the hormones. And so we hear a lot of times that we're constantly recommended to reduce our cholesterol levels and prevent heart disease by reducing the levels as much as possible. But we have to remember that cholesterol plays a very important role in the body, and specifically in this case in the production of hormones. So I wanted to point that out. And as you can also see from cholesterol, a lot of the other hormones like progesterone, testosterone, estrogen, they all are interconnected in that way. So that's a little bit about how hormones are produced in the body. Now, when we talk about symptoms, specifically about female hormones, and we're starting with estrogen first. Now, estrogen symptoms. Estrogen is a hormone in women that is a very important hormone that is made in the ovaries, and it is made from the release of FSH and LH, which are chemicals or hormones that come from the brain. So there's a signal from the brain down to the ovaries, and that's what results in the production of estrogen. Now, estrogen will fluctuate over the course of a woman's life. It will, as you know, in the cycle, it's going to go up and down depending on the time of the monthly cycle that she's on. And its levels are going to start declining later in life. So as the perimenopause stage comes, which for many women it can be in the late 30s to early 40s and continue on through the 40s until she gets to menopause, which usually is happening at about 50 to 51 years of age. So the estrogen levels are going up and down until then, and then at menopause, there's a steep decline in the estrogen levels. So what are some of the symptoms on the left side that can be associated with low estrogen? Is poor memory, depression, emotional fragility, wrinkles and skin problems, hot flashes and night sweats, bone loss, bone mineral density loss, and low libido. And what are some of the symptoms that can be associated with increased estrogen, which can be a problem for many women, is heavy bleeding, water retention, rapid weight gain, increased breast size, fibroids, endometriosis, migraines, mood swings, brain fog, and gallbladder problems. So you can see that this imbalance causes many symptoms, causes many problems, and needs to be addressed. So that's estrogen. Now, talking a little bit about progesterone. So progesterone is a hormone that, again, gets secreted by the ovaries, and it's going to primarily be responsible in the second half of the cycle. The second half of the cycle is when the progesterone levels are going to increase, and the progesterone is the primary hormone that's responsible for maintaining a healthy pregnancy. And oftentimes, when miscarriages happen, they happen because the progesterone levels were inadequate, and that's why, in some cases, that's why miscarriages occurred. Now, the low progesterone symptoms are PMS, which stands for premenstrual syndrome, cyclical headaches, painful swollen breasts, irregular cycles, heavy painful cycles, ovarian cysts, and then disrupted sleep or insomnia can occur. We often don't see excess progesterone issues unless someone is taking progesterone, and then it's a problem. But usually we don't see excess progesterone causing a problem otherwise. Testosterone, I mentioned testosterone in the female side as well, because testosterone is usually considered a male hormone. But what's very important is that testosterone actually has many important functions in women, and actually the total amount of testosterone that a female has is more than her estrogen. Even though it's about a tenth of what men have, still the total amount of estrogen is actually more, indicating that it's quite an important hormone. So you can have, again, decreased muscle tone, lack of energy, stamina, decreased libido, hair loss, poor body image, whereas increased testosterone, excess testosterone, can cause excess hair, acne, skin or greasy skin, thinning of head hair, unstable blood sugar, depression, anxiety, and then infertility can occur as well with a syndrome called PCOS or polycystic ovarian syndrome. So it's very important to get testing done, and there are many methods of testing. The most common ones are blood and urine, and they're actually the most accurate methods of testing. So blood is usually the gold standard for testing hormones, but it depends specifically on what hormone you're trying to test. That will tell you what is the best test. Saliva, some people prefer using saliva as a test for hormones. Now, so the thing about saliva is that it might be good as a baseline when you're not on any hormones, but it's going to be very inaccurate if someone is taking hormones and then needs to monitor their levels. Saliva becomes very inaccurate. So generally speaking, blood and urine are the best forms of testing. I mentioned a few ranges here. Again, with estrogen or estradiol, it depends where on the cycle you're at. And if you are postmenopausal, when your levels are going to be very low, then generally aiming for around 40 to 50 is going to be what we need for optimal levels in order to prevent symptoms and in order to have like a good bone mineral density, good cardiovascular health, and so on. Progesterone, generally speaking, it depends on what day in the cycle you're testing progesterone. So if the best time to test it is roughly at that 18 to 21 day mark in a female cycle. And testosterone as well, there's a total and free testosterone, so there's two levels that should be checked. So that's just a little bit about testing. Now, when we come to treatment, what we're trying to do differently, the way that I try to look at things differently is to not just use a simple, okay, what medication can I give to this patient in order to fix her issues? Because, as I mentioned initially, the development of chronic disease and all these imbalances that we have a big role, or a big component of it is our diet and our lifestyle. And if we don't address that, then we can take all the medication in the world and we often don't get better. So when we talk about estrogen, we're talking deficiency and excess. How do we treat those? Well, if we have deficiency, then we can use, first of all, diet is very important. So generally speaking, we tend to overeat, so that's one. We tend to eat a diet that's very high in ultra-processed foods, that is not enough fiber, not enough plant-rich foods, so fruits and vegetables aren't enough. So if we focus on, first of all, a general, overall healthy diet with removing processed foods as much as possible and focusing on whole foods and plant-rich, that's going to be very important. But also in lifestyle, acupuncture can be very helpful. That's been shown to be beneficial. And then avoiding overtraining, which means that there are some instances in which too much exercise can result in estrogen deficiency. And then there are certain supplements that can help. Now, this may not mean that if you have a deficiency, you can fully overcome the deficiency, but things like pomegranate seed oil, vitamin E, magnesium, all these can be adjuncts to the treatment that we're using. And then bioidentical hormones. So when I use the word bioidentical hormones, I'm basically talking about the exact same hormone that we have in our body. Whereas there are also synthetic hormones. The synthetic hormones are actually a lot of our hormone replacement therapy or birth control pills that are out there that get prescribed by physicians actually are synthetic hormones. They're not bioidentical. And why they're synthetic is important to know is that you cannot patent a natural substance. You cannot patent progesterone or estrogen and make money off of it pharmaceutically. So what you have to do is you have to alter the chemical structure of the hormone slightly so that you can then patent it. You're able to make a profit then, and that's the basis of these synthetic hormones. So we want to avoid the synthetic hormones as much as possible because they are the ones that have the most side effects, whereas the bioidentical ones or the natural ones are the safest. So to that, when we have a deficiency, especially like menopause, we can certainly and we should use estrogen in the form of estradiol, and that can be given as a patch, a cream, even vaginally. There's various different ways, but we'll talk a bit about how estrogen has been so misconstrued and linked with a lot of risks that it shouldn't be linked with. Excess of estrogen can be the lifestyle things, again, cutting caffeine, avoiding xenoestrogens. Xenoestrogens are basically chemicals that behave like estrogens in our environment. So think about pesticides, plastics, these types of things. When we have excess exposure to it, and our bodies do constantly because of the environment we're living in, then these can disrupt our hormone balance, and these can increase estrogen levels. Regular exercise, sleeping earlier, these are just general recommendations. And then there are certain supplements like DIM, which is diindolylmethane, turmeric, resveratrol, that help to balance the estrogen levels in cases of excess. Melatonin has been sometimes shown to improve or decrease estrogen levels slightly. Coming on to progesterone briefly, again, we were talking about deficiency and lifestyle. Stress plays a big part with progesterone, so improve stress management, stress reduction. Certain supplements are very helpful, like chasteberry, St. John's wort, vitamin C. These have been shown to improve symptoms related to low progesterone that we talked about in the previous slide, and they can be very helpful. But also, we can give progesterone as a hormone, as a prescription. That can be, excuse me, that can be in the cream form, where it's placed topically on the skin, or it can even be given orally. And for those women that are having difficulty with sleep and insomnia, which often happens around menopause time, orally has much more advantage because it can actually help with sleep much more. So that's about progesterone. And then testosterone, same thing. So again, when we talk about deficiency and excess, we're talking about lifestyle. Of course, we mentioned diet, but lifestyle, that involves exercise and movement, In excess, there's a lot of things like yoga, acupuncture, eating a diet that's lower glycemic index, which means our carbohydrate load in general, foods higher in zinc. And then the supplements that can help are, for deficiencies, zinc, L-carnitine, vitamin D, whereas for excess, things like chromium, inositol, vitamin D, cinnamon, these can help. I'm mentioning all these as general, and I'm happy to share the slides later, but again, these are things that we want to incorporate with our main treatment that we're giving. And then when it comes to bioidentical hormones, actually, a lot of women are actually on testosterone in the form of testosterone replacement as a cream, because when we check the levels in the blood, they are low, they have symptoms that we talked about, and they then can and should be supplemented. And as long as we're using the right doses, then there's no harm to, and as long as we're monitoring, there's no harm to testosterone replacement even in females. Okay. So now talking about a few myths around estrogen. Now, the first one is that estrogen causes breast cancer. I'm sure this is something that you might have heard, even if you're not very informed about the hormones in general, but this is something that a lot of times people fear that, oh, estrogen causes breast cancer, so we shouldn't. Now, where does this come from? Well, in 2002, they released a study called the Women's Health Initiative. And the Women's Health Initiative was a large study done that was trying to look at, does the effects that they've seen of hormone replacement therapy, because remember, hormone replacement therapy has been around for many, many decades. And what they're trying to see is that all the benefits they saw of hormone replacement therapy, could they replicate those in the form of a study for these postmenopausal women that they put in the study? And they concluded that estrogen, that when they give women hormone replacement therapy, their levels of breast cancer went up. So all of the headlines and everything came out as estrogen causes or increases the risk of breast cancer. Whereas now we know 2 decades later that was actually completely wrong. That study was a poorly done study. They got the analysis wrong. And we now know with subsequent reanalysis that estrogen does not cause breast cancer. In fact, it is very safe as well to use. So that's the first myth. And this is important because there are a lot of women that are in the menopause range that can benefit from estrogen as a bioidentical hormone, but they won't be put on it because either they or their physician is concerned about the breast cancer risk. And like we just mentioned, it's not, that's not a risk that we should be worried about. Second one is estrogen causes increased heart disease. That was another conclusion, a wrong conclusion from that study, that we now have had many other studies that help us to see that estrogen actually does not increase heart disease. Okay, so we're now going to switch gears and talk a little bit about hormone balance in men, and then we'll open up for Q&A, inshallah. So hormone balance in men, again, many hormones are involved. Testosterone, DHEA, thyroid, insulin, cortisol, so many hormones, we could be talking about it for many hours. But here we're just focusing on testosterone because that's usually the most common and one of the more misunderstood hormones as well. So a little bit about understanding how testosterone occurs. First of all, testosterone is, just so you understand, it's an important male hormone because it is important for all the secondary sexual characteristics of men. It's important for muscle mass, bone density. It's also an important brain hormone. So testosterone is important for good brain function, and that's why when you have testosterone deficiency, you have many brain symptoms as a result. So I put this there just to show the relationship from the brain down to testosterone and how that's produced. And so the signal is coming from the brain, specifically the hypothalamus and the pituitary gland, and that this whole axis is responsible for testosterone production. The signal then goes from the pituitary gland in the brain down to the testes where we make testosterone, and then it gets secreted into the system. And then it's a negative feedback loop, so it tells the brain that, oh, there's too little testosterone, there's too much testosterone, and it achieves a careful balance from that. So what are some of the symptoms of low testosterone? So low testosterone can cause fatigue, it can cause apathy or a sense of decreased vitality, if you will. It can cause loss of muscle mass or difficulty gaining muscle. It can cause low libido, or meaning low sexual desire. It can also cause sexual performance problems like erectile dysfunction and other symptoms as well. It can cause depressed mood, irritability, and brain fog or cloudiness of the mind as well. So these are all the symptoms that can be linked to low testosterone. Now, what are the causes of low testosterone? Well, we have some genetic causes. So genetically, there are some people that have just low levels of circulating testosterone, and that is a different situation. They need testosterone. That's the only treatment that they that's the only treatment that they need, and that's the only way that they're going to benefit. But other than that, the majority of cases of low testosterone are actually due to some other factor. First of all, as we age, testosterone levels will decline about 1 to 2% loss per year. That's just a part of aging. Secondly, poor diet. Again, the same things that I mentioned earlier, our diet, our ultra-processed food, our standard American diet is going to result in lower testosterone. Chronic stress. Stress has a significant impact on testosterone levels, and so when the stress is up, especially chronically, then testosterone levels will suffer. Being overweight, being obese, and what we call metabolic syndrome, that is also going to reduce testosterone levels. Diabetes, obstructive sleep apnea. This is one that's very important and gets missed. So if you have hidden sleep apnea, which means a blockage in the airways affecting your sleep, that can in turn result in low testosterone levels as well. And then gut inflammation, because various GI-related problems and inflammation will eventually result in low testosterone as well. So all these things are important when evaluating the causes of a patient with low testosterone, and then when we come to what we can do about it. So what about the testing with testosterone? So whenever someone is concerned with these symptoms that we just mentioned in the previous slides, then they have to get their blood levels checked. When we talk about blood levels, we are looking at basic blood work. When I mention basic blood work, I'm talking about a complete blood count, metabolic panel, a lot of the tests that you do as a standard with your physician, that has to be done, vitamin D and so on. But total testosterone and free testosterone has to be checked in the blood, and that is the gold standard for testosterone testing. It's the blood, and it's specifically the total testosterone and the free testosterone. Now, when I say free, what I mean is that the testosterone as a whole in our body is being transported by various proteins, and when only about 2% of it, roughly, is the amount that's what we call bioavailable or free, that's actually acting and doing the job of testosterone. Testosterone, when checked in the blood, should always be checked in the morning around 8 a.m. That's when you get the most accurate numbers for testosterone. So if you're doing it at 1, 2 o'clock in the afternoon, it's often going to be inaccurate, and it needs to be repeated in the morning. And we also have to check other hormones like FSH and LH, as I mentioned, because we need to know what is the cause of it. So we talked about LH and FSH being the signals from the brain down to the testes, telling them to produce testosterone. So we have to see, is it a problem in the brain, or is it a problem down in the testes? And again, these other hormones can tell us a little bit more detail about that. And when it comes to treatment options, again, whenever someone comes with low testosterone and we've confirmed it on the blood work, then we always start by the basics first, the fundamentals. So I always talk about diet first, lifestyle, and when we talk about lifestyle, we're talking about stress, sleep, exercise. These are important basics, because if you don't have those figured out, if you don't have those fixed first, then you can take as much testosterone in the world, you are not going to get better in the long run. So when we're talking about diet, again, the same recommendations of more of a Mediterranean style eating, removing of ultra-processed foods and focusing on whole foods, plant-rich. We give recommendations to shop on the periphery of the grocery store instead of more so in the aisles, and avoiding those labels that are extremely long that have a lot of problems in them. A lifestyle, again, we talked stress management, movement and exercise, especially weight training. Weight training is something that's been shown to improve testosterone levels. Again, all of these might change the testosterone levels somewhat. It's important to put all these into your plan while we're trying to get better. And then sleep. If you're not sleeping a good 7 to 8 hours at the right time, this is important to address before we get to some of the more advanced things. And then addressing root causes. And what I mean by root causes is if there is a hidden sleep apnea going on, we should test for that and we should treat that. If there is diabetes, then diabetes needs to be controlled. If there are gut imbalances, then those need to be addressed effectively to make sure that we're improving testosterone as best we can. And then there are certain supplements and herbs like Tongkat Ali, Fedogia, which is another herb that has been shown to somewhat improve testosterone levels. DHEA, which is a precursor to testosterone. It means that it's in the pathway of testosterone, so you can supplement with that. And then there are also certain medications. So something like Clomid, or you might be familiar with Clomiphene. Clomiphene is a medication taken to increase fertility. And actually what it does is it increases the LH signaling so that the body can produce more testosterone. HCG injections, these are not used very frequently. I just put this in because this is a potential option as well. And then there is testosterone replacement therapy. So when you've taken care of all of the basics, you've found that someone has low testosterone levels, they have taken care of their diet, their lifestyle, they have taken care of, addressed all the root causes, underlying imbalances, then testosterone replacement therapy can be given as a reasonable choice. It can be given as a cream or gel, or more commonly as an intramuscular injection. And that intramuscular injection is once or twice a week. But what's very important to realize is that it should not be used for younger males, because if you are someone who is, say, 35 years old and you have low testosterone levels and you are still desiring children and want to maintain your fertility, then testosterone given as exogenously, meaning given as an injection or taken as a cream, it will end up reducing your fertility. So that's very important. So testosterone replacement should ideally be considered for those men at least 40 years of age, if not higher, and who have completed their families and not looking for any further children. And then it is a reasonable treatment option. And in that case, there are also some myths around testosterone replacement therapy. So the first one is that testosterone therapy does not cause prostate cancer. This is something that has been, it's just a misinformation piece for many, many decades. Many medical students, if you ask them coming out of medical school, will think that testosterone therapy does increase the risk for prostate cancer. It does not. This was based on very weak evidence and has been refuted. And testosterone therapy also does not increase the risk of cardiovascular disease. So it's the opposite is actually true. When you have low testosterone levels, you are at a higher risk for cardiovascular disease. So testosterone therapy does not increase risk of cardiovascular disease. So I will take a pause here, and this was just a little discussion about balancing hormones in women and men, and we can take a few questions or discussion, and then here is some clinic information of mine and website and phone number and all. So we can take some questions if anyone has, and Jazakallah khair for listening and your time.
Assalamu alaikum. I missed that slide, but what is the effect of high cholesterol? And is the medication like required? Is like mandatory? I have to take medication? Or what would be the other solution beside the medication?
Are you talking about testosterone deficiency?
Not cholesterol. Cholesterol.
Oh, cholesterol. Okay, cholesterol, yeah. So the first question was, what is...
Effect of high cholesterol?
oh, high cholesterol, okay.
And is the medication required, or let's say mandatory?
Okay, so that's a good question. So first of all, right at the beginning in the slide I mentioned the reason I brought up cholesterol was because cholesterol is what makes the hormones, right? So first we have to understand that we continue, we take these medications to decrease the level of cholesterol, but we need a good amount of cholesterol to make sure all of our body functions are happening well. Secondly, when you have high cholesterol, if it is too high, yes, and if with the correct risk factors, the development of heart disease, cardiovascular disease is high. And when we say cardiovascular disease, we're talking about heart attacks, strokes, kidney issues, all that stuff goes up can go up with increased cholesterol. So, but the problem in the medical system is now that when you go to your doctor, you're going to get a standard test, okay, a few numbers. They're going to be, and based on those numbers, they're just going to say, okay, you need to go on medication, and they'll put you on medication, and you'll be on medication for many, many years or the rest of your life. Whereas I think what's missing is that there isn't a discussion about the nuance of the risk. What I mean by that is that it's not just about your exact cholesterol number. There's so many other tests we can do to say that you have a higher risk or someone else has a lower risk, right? So when it comes to starting a medication, your question was, is it mandatory to start it? It's not mandatory to start any medication. And I think, and this is a longer discussion, but the cholesterol medications have been overplayed in the amount of benefit, absolute benefit they can give you. In other words, people think that they can add years and years of life to them if they take a cholesterol medication. But it's not true. The studies actually will show that it's not going to increase your quantity of life that much, not by many years, okay? So now, does that mean that they're not useful? No, they can be useful in many situations and should be taken in certain situations. But the point is, you should have a detailed discussion with your doctor about the risk. Like, do all the tests, and then if all these tests look bad, and then it's, okay, can I change my diet? Can I change my lifestyle? Can I decrease my stress? Do all that, and then check the levels again. If the levels are better, you may not need to be on medication. If they're still bad and you need to, then yeah, so.
Assalamu alaikum. I have a couple of questions. You can choose to answer one or all. Firstly, for someone who is experiencing extreme fatigue, what is the recommendations to start? Should he start with medicine? How to break out of that? Because I read regular exercise, it can help with increase in testosterone.
Yeah, so regular fatigue, and fatigue is one of those symptoms that is very, very common. It's one of the most common symptoms that people go to their physician about. I'm tired, I'm fatigued, I'm exhausted, First thing is to figure out why you're fatigued, right? And to figure out why you're fatigued, we have to try to go down the list of all those things that can make you tired. So number one is, are your thyroid levels okay, right? Are your vitamin D levels okay? Are your iron levels okay, right? Do you have any sort of autoimmune condition going on in the body? So basically doing all the blood work things that can check the most common things, right? So it depends. Now the other thing is, we talked about sleep apnea. Do you have sleep apnea? Because sleep apnea can make you very tired. So if you're snoring at night, if you're having excessive fatigue in the daytime, if you're overweight, and if you find yourself you're sitting there, you're falling asleep, you're at work, you're falling asleep, those are all concerning symptoms for sleep apnea. Then you might need to get a sleep test done because maybe your fatigue is coming from sleep apnea. So the point is basically you have to figure out what is the reason for your fatigue. The other thing could be is an actual GI problem. Because oftentimes what happens is that if we're eating certain foods that are not, that we're sensitive to, our immune system does not react well to, then we can be getting tired as a result or have other symptoms as a result. So changing diet is also very important.
Second question was like, does any of these hormone impact metabolism? Like if someone has like lower metabolism, like what he or she should be doing?
Yeah, so when we talk about metabolism, we are talking specifically like, for example, when I mentioned insulin as a hormone, right? So insulin and your insulin, testosterone, all these are linked. So insulin is when we have poor metabolism, or when we say someone has metabolic disease or insulin resistance, then we're talking about that insulin situation. And that closely links with testosterone as well, because if you have insulin resistance, you're going to have low testosterone levels as a result. You can. So it's very important to address all these, and that's why there is a recommendation to get your levels checked, because you want to make sure there's no hidden hormone imbalances that you have, thyroid related, insulin related, and so on, and even testosterone related. So it's just part of being proactive about your health, is just to make sure your blood levels are good, because if you're having symptoms, you should not be ignoring it. A lot of people ignore their symptoms. A lot of us, we just go through, I'm always tired, I'm always this, that, and we're just ignoring it, whereas it could actually be a deeper problem.
Yeah, lastly, I think for kids, I think these hormones play into effect after like someone reaches puberty, right?
What's the question? They don't play in a...
These hormones come into effect after someone reaches puberty.
Yes, exactly. So these ones I'm talking about after puberty, because when we're talking about estrogen and progesterone, we're talking about the cycle for the female has started, and we're talking about the male has gone through puberty. So in that case, the testosterone levels are going to go up. That's when all this will happen. And specifically, we're not talking about like teenagers, because usually their levels are going to be pretty well balanced or on the higher side. This is more about men in their 30s, 40s, 50s, and onwards. Any questions from the sisters?
Yeah.
No?
Assalamu alaikum.
Alaikum salam.
2 questions. One is about medical cannabis in this framework. 2, the slide that you put up for the treatment of testosterone. Can you put that back for me?
Let's see. Which one was that?
The one before this.
This one?
No, this one.
Treatment?
Yeah, this one, right?
Okay.
Thank you. So that's it.
Yeah, and the second question was what?
This is the second one. The first one was about medical cannabis in this framework.
Okay.
Medical cannabis.
Medical cannabis. And
Medical cannabis.
Okay. And the second, just to put the slide up. I see. Okay. Yeah, I mean, cannabis has now, they're again coming up with all the studies to show, certain benefits that it can provide from a mental health perspective, from, all these things, sleep, so on, that it can provide. I still think that some of the risks of it do get downplayed, and so that's what I don't like about it so much. I mean, as an alternative, it can be beneficial. Like if someone is, for example, someone out there is drinking versus taking medical cannabis or using cannabis, that's the better option in terms of health. But I think that some of the risks don't get talked about as much, and I think that so it's a balance. Now, for me, as a Muslim practicing, there's been a hesitation to get deeper into the cannabis and what are the rulings around it. So I personally have not delved into prescribing it to patients or recommending it to patients. I think if you take some of the CBD oils, and again, this is not a this is nothing from the religious side. That you'll get from the imam, whether it's okay to take that. But taking it, for its health benefits in the CBD oils and so on is usually okay. Yeah. Yeah, acupuncture is more of, it's usually the practitioners that are more Chinese medicine based that specialize in acupuncture more so. And so I don't have very deep knowledge about the specifics of acupuncture in terms of how it can help, but it is just as an adjunctive where if someone is coming and saying, look, I have, this is my deficiency or hormone imbalance, then it can be an add-on because acupuncture in general has many health benefits, and one of them is, the reason I put it up was one of them is just helping to balance the hormones a little bit. So I don't unfortunately have too much in-depth knowledge of acupuncture since I'm more on the medical side, but mostly the Chinese medicine practitioners and Eastern medicine will be able to answer that better. Sorry.
One question, does use of any gadgets impact any hormones?
Yeah, I think that we're all, in a place where our phone use, our technology use, computer use is impacting for many reasons. Not just the direct impact, but also the indirect impact. Because, for example, when you use your phone late at night, then your hormone levels automatically are going to be impacted, meaning your cortisol, right? Cortisol is the hormone that is your stress hormone, so it's meant to go up in the day and then decrease at night so that you're not at high stress at night and you can, you can calm down at night and your melatonin can be higher and you can go to sleep. But using phones at night with the lights that they emit, not having that phone free time, having all these artificial lights definitely impacts hormone levels, and then it's going to impact sleep, and it's going to impact so many different things. So yes, it has a strong impact. I think they're coming up with more and more studies about technology and the health risks to it.
Jazakallah khair.
Thank you all for listening.